Assalamu alaikum. Have you noticed changes in your bowel habits? Are you facing persistent constipation or diarrhea? Have you seen blood in your stool or lost weight without trying? If so, don't ignore these signs. They could indicate colorectal cancer. Today, let's discuss colorectal cancer in simple terms and highlight the importance of early detection. Colorectal cancer develops in the colon or rectum, parts of the large intestine. It's one of the most common cancers globally, yet it's also highly preventable and treatable when caught early. While it's more common in those over 50, younger adults are increasingly diagnosed, so persistent symptoms should never be overlooked, regardless of age. Risk factors include a family history of the disease, colon polyps, obesity, smoking, excessive alcohol consumption, physical inactivity, diets high in red or processed meat, and certain genetic conditions. In its early stages, colorectal cancer may show no symptoms. As it progresses, symptoms may include changes in bowel habits, persistent constipation or diarrhea, blood in the stool, abdominal pain, bloating, unexplained weight loss, fatigue, anemia, or the sensation of incomplete bowel emptying. Here's a crucial point. Not every instance of rectal bleeding is due to hemorrhoids. While piles are common, blood in the stool can also be an early sign of colorectal cancer. It's essential to seek medical evaluation rather than assume the cause. If you're 45 or older or have a family history of colorectal cancer, consult your doctor about screening, even if you have no symptoms. The most effective screening test is a colonoscopy, which allows the doctor to examine the entire colon and rectum. During this procedure, precancerous polyps can often be removed, preventing cancer from developing. If diagnosed, treatment depends on the cancer stage and may include surgery, chemotherapy, radiotherapy, targeted therapy, or a combination of these. The key message is that early diagnosis saves lives. When detected early, many patients can be successfully treated and continue to lead healthy, productive lives. To learn more about colorectal cancer, hemorrhoids, anal fissures, anal fistulas, and other common surgical conditions, visit Professor Dr. Zahid Mahmood's website, www.professorzahid.com. The site offers trusted health information, educational videos, articles, and practical guidance for patients, medical students, and healthcare professionals. If you found this video helpful, please share it with family and friends, especially those over 45. Your share may encourage someone to get screened early and could even save a life. Thank you for watching. Stay healthy, never ignore changes in your bowel habits or rectal bleeding, and remember, early detection and timely treatment can make all the difference. Allah Hafiz.